Welcome to APPNA Alberta Chapter mental health discussion in relation to COVID-19. My name is Dr. Dania Imam. I'm a family physician at Ogden Medical Clinic in Calgary. Today we have two renowned panelists with us to talk about impacts of COVID-19 on mental health. Our first panelist today is Dr. Hussam Bawa. He is a psychiatrist with Alberta Health Services, and he is also a clinical assistant professor with University of Calgary. He has earned awards in 2003 and 2015 for excellence in clinical teaching. He has also received People's First Award for Shared Mental Health Services in 2005. Our second panelist today is Dr. Raheel Syed. He is a forensic psychiatrist with Alberta Health Services. He has served as an expert witness in general and forensic psychiatry to the Alberta courts. He has received an award from the Canadian Academy of Psychiatry and Law Fellowship, and has also been awarded with R.H. Mewburn Memorial Prize in Forensic Psychiatry. I will start with you, Dr. Bawa, first. My first question would be, if you could please shed some light on mental health impact of our general public due to this COVID-19 pandemic.
Well, the way COVID-19 pandemic has arrived in Canada, it was rather a bit abrupt, even though the COVID-19 was coming in our way. But on March 11th, when WHO announced as a pandemic, then we have seen really the effect all over the country. After declaring pandemic, it was a stressful situation all over the country, all over the world. Different part of the world and different people, they do react to this stress differently. Imagine, a household with a couple and two kids, and imagine the people who have got a mental illness or chronic physical condition like diabetes. So I would categorize into 6 different situations. As I said, people may react differently, but 6 different situations are, namely, number 1, where people will worry about their own health or their loved one health. People may have some biological symptoms like, difficulty or in sleep, or having a different eating habits, including comfort eating, difficulty in concentration and sleep. That's number 3. Number 4 would be the worsening of underlying medical condition like diabetes, high blood pressure, for example, or asthma. Number 5 is worsening of the mental health condition like depression and anxiety. Number 6 is usage of alcohol or other substances, including tobacco. As I said, there are some other situations also where people may behave differently. And these days, of course, you have to also include social media or media time. Besides this, as I said, imagine a couple with 2 children. So after this lockdown, their lives has completely changed. Parents are at home, they're working from home, children are not going to school, so they have to also address worries about children, and that is very important to address children's issues. So acknowledge children's concern, whatever they are, they're worried, and explain in plain language, plus try to avoid all the myth going around about COVID-19 and social media. Another important thing is to minimize the media time, including TV and social media. Have a routine. If you don't have a routine, create a routine and try to follow the routine. Old style, kitchen table discussion at the dinner time, that's very important. If you are a person who have got some spiritual connection, try to connect with this spirituality. If you are a person who likes to meditate, do yoga, try to do yoga or meditate, whatever you like, whatever it helps you to relieve stress. That is very important. Plus, a good, simple communication to your old friends that may also help you. Sometimes doing the household chores that will also appreciate your partner. And sometime when you're doing, for example, watering the plant and you try to verbalize with plant, that is normal. But if plant talking to you, then you need to come to me.
Thank you so much, Dr. Bawa. Dr. Syed, I will move on to you. As you know that COVID-19 has had a huge impact on businesses and finances. Could you please tell how it is impacting on crime and street violence nowadays?
Excellent question. So early indicators show that there are three main areas where there has been an increase in crime, and then there's also some areas where there has been a decrease. Now, the data that's coming in is quite fluid and dynamic, and so we'll probably find out in the upcoming months how much COVID-19 has impacted crime. So the three areas where we're seeing an increase, one of them is stunt driving and speeding. Looks like the streets are a little bit empty, so people are taking advantage to drive at excess speeds and doing some kind of stunts and things of that nature. The other area where there has been an increase appears to be in commercial break-ins and thefts of vehicles. So usually stores that were occupied by people, they're left closed for prolonged periods of times now. So it looks like certain individuals are taking advantage of that, and they're engaging in kind of opportunistic theft. And the third very relevant area would be there appears to be an increase in the domestic violence complaints. And some regions have demonstrated a 22% increase in the number of complaints that are coming in. And they can range from verbal arguments in the home to significant domestic assault. Now, the areas where there's been some element of a decrease has been one in there are fewer traffic violations. And that makes sense because there's just fewer vehicles on the road in general. And the other is there's less drunk driving as well. And the third area is some regions are showing fewer fraud and potentially fewer weapons related offenses. So it looks like overall there might be a slight decrease in all of the major crime areas per se, but time will really tell. So I would advise people to kind of maintain the same standards of security and safety that they previously had during this time as well. So making sure that you're locking your vehicle, using standard kind of security around your house and your business would be recommended.
Perfect. Thank you so much. Dr. Bawa, the next question is for you. You know, in general, people are staying home, but some people, they have to go to work. And there has certainly been a lot of anxiety and fear around going to work, and people are avoiding. How we as doctors can reassure them, and what advice would you give to those people?
In some situation, the anxiety is very real, especially those people who have got past history of anxiety. In those cases, very likely their anxiety will get worse. And in some situation, the anxiety about current situation is also real, but we have to really realize that the issue of claiming disability. So company and the employer have got responsibility of providing a safe environment. So discussion with the HR may help, or trying to accommodate the employers or employees concern may also help. As I suggested that, you know, they should go to the Alberta Health Services site where it is clearly written about how to do the self-assessment. That should reassure, but it is coming again and again, then this person needs some counseling. And as a family physician, they will come directly. That's the first part there. They will come and ask for sick note, It's really it's a concern, and I think as a family physician, they all have to deal with the situation, individual situation, and if it is going prolonged, then the chances of insurance provider, that they may ask more information. You may have to provide more information, and in that case, I think I don't know how the industry will react to this situation, because this is going to be a huge issue in future. Currently, at this point, there's no specific guideline for this situation, but there's definitely a guideline for usual situation. My suggestion to the family physician would be just write down the typical day, how they are passing the typical day. That will help them to move from their typical day, and where is the stress, whether the stress is at work or outside the work. So then it has to, you have to address the issue of uh, workplace issue.
Okay, thank you so much.
If you allow me, I would like to add something about the domestic violence and current situation. The very the various research about domestic violence and mental health is related to face-to-face contact. If the period of face-to-face contact or interpersonal distance is less, then we have seen there is hostility, there's criticism, and then there's verbal violence, and there is physical violence. So, which is very understandable. And this term was used as a express emotion.
Thank you so much, Dr. Bawa. Dr. Syed, I have a question for you. As you deal with forensic psychiatry, of course, crime, and how do you think it is affecting the people who suffer with addictions?
So a recent NANOS poll was commissioned by the Canadian Centre of Substance Abuse, and what they found is that there has been a clinically significant increase in alcohol consumption of Canadians under the age of 54. And some of the main reasons that were cited for the increase, that the individuals that responded to the poll said that, one, there was a lack of schedule, as Dr. Bawa has clearly articulated, in that the normal barriers between, during the week they would work, weekends they would be freed. Those barriers or boundaries are now a little bit blurred. So having that lack of schedule seems to be contributing to an increased use of alcohol. The other two major reasons cited was boredom and social isolation. So just not having as many activities in their day to preoccupy them. And the last major reason that was cited was stress and anxiety related from the pandemic. Now, one of the challenges is that people that are substantially drinking a lot more, and let's say, for example, whether it's drinking or even cannabis, both of these substances can potentially interfere with the immune system and can make individuals more susceptible to other illnesses. So if people are substantially drinking in this specific time or using other illicit substances, there can be some other medical comorbidities and problems that can stem from that. Clinically speaking here in the Edmonton region, it appears we've had an uptake in our opioid dependency clinic as well. And it seems like the supply of opioids from foreign countries may be drying up to some extent, and that's motivating individuals to reach out to clinics such as the opioid dependency clinic in order to get their addiction adequately treated.
Great, thank you so much. I do have another follow-up question. I know you work with domestic violence team. Have we seen any increase? I know Dr. Bawa has spoken about it as well, about the domestic violence. Have we seen any increase in the cases of domestic violence?
Excellent question. So the UN Secretary General Antonio Guterres, he recently remarked that there has already been a horrifying global surge in domestic violence, and he was advising all governments to make preparations to address kind of the violence that is occurring towards women during this specific time. And it kind of makes sense, as Dr. Bawa clearly articulated, was social isolation is in some respects will likely be contributing to rates of domestic violence because um, individuals that engage in domestic violence, a lot of it has to do with the sense of control, power, and isolating people from their friends and family. And hence the current social distancing guidelines kind of aids in that fabric of domestic violence. Um, on a clinical level here, what we're seeing is that there definitely appears to have been an increase in the number of phone calls that are being made to domestic violence and family violence support programs and support lines. Police have also seen an increase in domestic violence related calls, but at this stage, and it varies from region to region, it appears that most of those calls seem to be related to verbal arguments and dispute. Um, we'll have to see exactly what happens in the long term in terms of the amount of serious physical violence that individuals or emotional violence that they're experiencing, because one of the challenges is that a lot of the shelters have reduced capacity and some of them have closed down. And so victims might actually feel quite trapped and they may feel uncomfortable reaching out to the police due to repercussions where they may experience if, let's say, they were not able to leave the home. So I think the gravity of this pandemic will become much more apparent once this pandemic starts to subside. So I would say overall, I would definitely believe, and it makes sense that the rate and risk of domestic violence and family violence as well towards children is likely increasing, and it'll become very evident once the pandemic starts to kind of slow down and resources and supports open up.
Thank you so much. Dr. Baba, I have another question for you. If you could highlight some short and long-term repercussion on our mental health due to this pandemic.
Yeah. Well, this is, something which is very new. The world has not seen this kind of disaster. But if you go back to the World War II studies, so what has happened that after World War II, the first year we have seen increased rate of major depressive disorder, and following that we have seen a lot of anxiety disorder and increase in alcohol consumption. So very likely we are going to see a lot of mental health issues after a year or so of pandemic. And government is actually spending and planning to have more services for mental health. Currently, at the moment, looks like that but we are going to see the surge in mental health issues in coming years.
Thank you so much. Dr. Syed, I have one last question for you. What do you think are some of the impacts on emotional health due to this pandemic? And could you please give some advice on how to mitigate these impacts of social distancing on our emotional health?
Sure. So I think as time goes on, the impact will become very evident and very clear, as Dr. Bawa has articulated. If we look back to some of the other outbreaks in the recent past, for example, the SARS outbreak, there was a 2003 study done by the CMAJ, and what they were looking at were immediate psychosocial impacts of the SARS outbreak. And some of the main areas emotionally that people were struggling with, according to that study, was fear, loneliness, boredom, and anger. And obviously, as things subsided, as Dr. Bao articulated, problems such as depression started to set in. Another area where people might start experiencing difficulty would be in the risk of developing post-traumatic stress disorder as well. Specifically with those who have developed COVID-19 and those that have had family members who've developed it, as this can be a very traumatic event for individuals to experience. The good news about, let's say, PTSD is that vast majority of the individuals do end up improving and remitting. That's always a good sign. The other challenge is that with the social distancing that the governments are encouraging, I think it's important to differentiate between social distancing and physical distancing. In that, having individuals completely socially distancing, meaning that, let's say, they're not communicating with one another at all, that obviously is going to have some very serious mental health implications as well. Just because we're physically distancing doesn't mean we should be social distancing. And so some strategies around that, while maintaining physical distance, would be connecting with friends and family using telephone, using the internet, WhatsApp, video conferencing, and there's all sorts of different applications where you can actually play games as well through the internet with your friends. So these all things combined together will help address the social isolation that individuals are experiencing. The other thing is that we also know is that if individuals have pre-existing mental health difficulties and some people who are just feeling quite lonely, the risk of suicide can drastically increase as well. There's a lot of evidence showing that unemployment, mental health, unemployment and mental health difficulties both contribute to the increasing risk of suicide. And if you go back and look at studies around the 2008 time period when the economy wasn't doing so great, the rate and risk of suicides was increasing at that time as well. So I think one of the major ways around that at this stage is reaching out to your healthcare providers if you can. Having telephone or video assessments with them is extremely important. And for family physicians as well, as reaching out to your patients that you know are at high risk of suicide or have pre-existing mental health problems, I think would be very important. And then maintaining social connection and interaction with others is very important. So spending time, as Dr. Bawa explained, with family, with friends, through these social media platforms may be helpful in addressing that social isolation and distancing piece.
Thank you so much. Dr. Baba, do you have any last few pieces of advice for us at all?
I just want to leave you with some website. So one Canadian website, which is Center for Addiction and Mental Health, camh.ca. This is a very useful website. Another website is Chicago-based National Institute of Mental Health, NIMH. That website is pretty good. Another website is UK-based Royal College of Psychiatrists, rcpsych.ac.uk. These three websites are professional websites and have a very useful information.
Resources that I would recommend Albertans should have on hand if they're experiencing any form of violence or domestic violence related issues. First is obviously if there's any severe violence or something that you're experiencing and you're worried about the safety of your life, you can always call 911. For child abuse, the number to call would be 1-800-387-KIDS, KIDS. There's also a family violence information line, and the number to call is 310-1818. So there's no area code for that. You just put the phone number in. And then if you suspect some element of elder abuse that is going on, whether they're in a care facility or in a hospital or someone's taking care of them, the number to call would be 1-888-357-9339. And finally, there's also an anonymous web chat that is available through the government, and the website for that is alberta.ca/safety chat. So these are some resources that it's always good to kind of have on hand for you guys as well if you're experiencing any kind of abuse or violence.
I would like to thank you both, Dr. Hussam Bawa and Dr. Raheel Syed, for taking time out to talk to us today and sharing your expertise on this APPNA Alberta platform. We hope to bring you more informative sessions on COVID-19 pandemic. Please stay tuned. Thank you so much.